大家好，我是冯忠贤医生，是马来西亚视网膜专科医生。谢谢你们介绍我来跟你们讲微脉冲激光疗法怎么样帮助你的黄斑的病。我用这个方法帮助我的病人是做11年了，非常很好，也是很安全。今天我要跟你讲我怎么样用这个微脉冲激光疗法帮助两个病是黄斑病变也是 CSR。现在我要跟讲英文，因为我的中文华语不大好，对不起。Firstly, I'd like to share with you that in the last 10 years, intravitreal injections have become the major way to treat most of our retinal diseases like macular degeneration, diabetic macular edema, and retinal vein occlusion. As you can see from this study here, more than 20 billion US dollars will be spent in America alone on intravitreal injection. And in a survey done, you can see that the number of laser procedures have been reducing over time because intravitreal anti-VEGF injections has grown to replace laser as a major treatment modality for macular diseases. But we still need laser for macular diseases for several reasons. First of all, many countries cannot afford continuous intravitreal injections. Countries like Malaysia, where I work in, we have a limited budget for our patients, and while we do offer anti-VEGF injections, we can't carry on giving them forever, and laser is a very important treatment option. We are also seeing more and more cases of diabetic macular edema, central serous choroidal retinopathy, and proliferative diabetic retinopathy. And this means that laser remains an important treatment option for these patients. There are also many cases of DME and CSR that do not respond to anti-VEGF injection, and you still need to do laser for these cases. What do we mean by subthreshold laser? And this is a very confusing terminology that has been going on for many years now. And firstly, the most important thing is you cannot see any visible changes to the macula when you do the laser. And even if you do fluorescein angiography, OCT scan, or autofluorescence, you may not see the changes seen because the laser power use is below the damaging power to the retinal pigment epithelium. There are many different types of laser. We have the TopCon endpoint management, or you have the LX, very short nanosecond duration. But the one I'm going to talk about today is the main technology called pulsing technology, which has been around for almost 10 years. And the one I'm going to focus on is the Subliminal technology done by Quantel Medical. But there are also other companies that use quite similar modalities, but using different names. What are the main issues that we have with subthreshold laser? There are many different treatment parameters used and published in the past. And a lot of inexperienced users are around, and they use very low power. Sometimes the power is too low to have a treatment effect. And I will be able to share with you what the ideal treatment parameters are for subthreshold laser. DME cases are often treated very late after they have failed many anti-VEGF or steroid injections. So these patients, once they're treated with laser, they don't often do well. But I'd like to share with you that it's better to treat these patients early on with laser so that they have a better effect. And to date, there are no clinical trials comparing subthreshold laser versus anti-VEGF, mainly because the pharmaceutical industry do not really have the budget to fund such trials, and it's expensive to do. But I know that in the UK, in the National Health System in UK, they have started a trial comparing subthreshold laser combined with anti-VEGF for diabetic macular edema, and we look forward to the results in the next 1 or 2 years. How does subthreshold laser work? Laser works by stimulation of the RPE cells and to increase reduce the cytokines and increase the MMPs to be able to reduce the macular edema. You do not need to kill the RPE cells like when you used to do a traditional laser, whereby you have to burn the retina with a dead zone and a sublethal zone. but you just need enough energy to stimulate a response from the retinal pigment epithelium cell. And this is how subthreshold laser works. This is my current treatment parameters. I do not need fluorescein angiography. I use an OCT scan and I use a thickness map, and I use what we call 5% duty cycle. And the very important thing is you have to titrate your power. This means that you treat an area outside the macula with the power until you see a burn, then you reduce the power by 50% and treat the thickened areas as seen on OCT scan. And I use a spot size of 160 microns, and I treat a dense pattern, treating the entire area of the thickening, and I wait. It's very important for you to be patient for the treatment effect, because laser takes a bit longer to work than anti-VEGF. So you need to wait up to 12 weeks and monitor with OCT scan, sometimes with autofluorescence. How do you do subliminal subthreshold laser using the Easyret Quantel medical machine? First of all, you can use many patterns. I often use a single spot if the macular edema area is very small, but you can choose squares or customizable grids. Then you look at the OCT map and you can see there's an area of thickening there, and you choose a suitable grid size to fit that area. And then you remember where it is when you look into the laser machine, and then you adjust the adjust your power, and then you go to your subthreshold subliminal laser mode at 5% duty cycle and treat the whole area of thickening. So you can use either a square or macular grid for this particular area of edema, or a single spot. If the patient moves during the laser, you can take your foot off the pedal. The Easyret Quantel Easyret machine has a resume function that remembers where you stopped during the laser, and if you press the foot pedal again when you're in resume mode, the laser will continue treating the areas that have not been treated. How does subliminal subthreshold laser work? This has been around for more than 10 years, and Quantel Medical has been one of the pioneer companies doing this treatment. And what happens is, if a full continuous train of laser power is then chopped up into small pieces, pockets of energy to hit the sub-RPE. And then this then creates a very low power effect at the RPE level. And in between, there's time for the retina to cool off and not be damaged by any scarring. A duty cycle is really an expression of how much energy you deliver on tissue. This is also used when you do phacoemulsification for cataract surgery. There's a certain amount of duty cycle as to how fast, how strong, and how quickly the ultrasound probe is moving. And this is similar when we do laser. So basically, to get a 5% duty cycle, the laser is on for 100 microseconds and is off for 1,900 microseconds in between. So there's a short on time and a long off time in between the laser pulses. And you can adjust the duty cycle, but 5% is more than adequate to achieve a treatment effect, as long as the power is adequate. The on and off times allow heat diffusion and allows tissue to cool. Classic 100% duty cycle is photocoagulation, which destroys the retina. But we need a cool 5% low duty cycle to achieve this treatment effect without scarring the retina. So there are many benefits to subliminal laser therapy, and you can preserve retinal tissues, and is known to have a long-term effect, and I often combine it with intravitreal injections, and I'll share some cases with you. Also, the benefit of the Easyret laser is that it uses the 577 nanometer wavelength, which is the ideal laser wavelength for treating the macula because of low xanthophyll absorption, good penetration to cataract, and the need for very low power. So the Easyret by Quantel Medical has a very clinically oriented user interface. When you switch on the machine, you can choose between single spot, multi-spot, or the subthreshold mode. And I use the multi-spot all the time for when I need to do pan-retinal photocoagulation for PRP laser. So the next step is that when I go to the interface, I will choose which mode I want to do, and then we can choose between these modes. If I'm doing a subthreshold laser, I use a subliminal mode. If I'm doing a PRP, I can use single spot or multi-spot mode. Multi-spot, just a quick 1 minute about how it works. It's slightly different. It's mainly for PRP laser for proliferative diabetic retinopathy, and it is very gentle, and you can do many spots in a very short period of time. I can do a full PRP for one eye within 10 minutes. And you can compare these two pictures where single spot mode versus multi-spot mode. On the left side, you can see there's much large spots with large scarring. On the right side, smaller spots, but much more gentle and less scarring of the retina. This is how the multi-spot laser works. There's an optical fiber going to the laser scanner, which produces the pattern that you need on the retina, and then it then produces it in a very high speed with no pain to the patient. So there are other customizable patterns that you can use on the multi-spot treatment mode, and you can choose between squares, circles, or different grids. I use a fixed spot size of 400 microns depending on the contact lens you use, and then a short pulse duration of 10 to 20 milliseconds, and this allows very little pain to the patient. This is the treatment page that you see when you're doing a multi-spot treatment, and I'm sure your local Gauss rep will be able to teach you further on this, or you can try it out at the exhibition booth. And I've mentioned before that a 577 nanometer spot size allows good penetration through cataracts and will allow you to use lower power to achieve a treatment effect. Okay, so going back to subliminal laser for DME, there are three types of diabetic macular edema that you can use with this laser. The first is extrafoveal macular edema. The second is foveal involving mild edema but with good vision. And finally, I think what I use most commonly is combination treatment for thick macular edema, whereby I inject anti-VEGF first and then do laser 1 or 2 months later. This case is from Spain by Dr. Alejandro Rios. And you can see there's extrafoveal macular edema temporal to the fovea, and this patient has had 1 session of subliminal laser therapy, and at 1 month there's reduction of the macular edema, and at 3 months there's almost no more macular edema, and the patient's vision is stable. No injection was required for this patient, and more importantly, there's no laser scar seen on the retina. This is a patient with centrally involving macular edema, and because you're only using 5% duty cycle at very low power, this is very gentle to the macula, and you can treat over the fovea. And this patient at subthreshold subliminal laser, very close to the fovea, at 1 month, edema had resolved, and at 3 months you could not see any more edema, and the patient's vision also improved. On the left here, you can see the color picture before laser. On the right, after 3 months after laser, whereby the exudates have almost all resolved and the edema has also resolved. What about this patient which has a fovea involving good vision, but also has macular edema, and he had 1 session of subliminal laser, and at 3 months all the edema has also resolved. This is a very common scenario where you have thick fovea involving macular edema, and I gave Dr. Rios gave this patient 1 anti-VEGF injection, and at 1 month the macular edema had resolved, but there's still a little bit more edema outside the fovea, and this was treated with subliminal laser, which then caused improvement of the macular edema, and also you don't need to give as many injections to these patients as well. The case of central serous choroidal retinopathy, CSCR, which you see a lot around the world. Among Chinese patients, I noticed a lot of them, if they are taking traditional Chinese medication that contains steroids, a lot of them develop this after 3 to 6 months. And of course, sometimes even after stopping the steroids, you still have residual edema. But this case is acute CSCR in a young man. And before we discuss the case, there's been some clinical trials comparing half-dose PDT versus CSCR. The PLACE study was conducted in Europe, and this compared half-dose PDT versus subthreshold 810 micrometers laser, and it showed that PDT is superior to subthreshold laser. But the problem is we do not use this 810 nanometer wavelength for laser anymore. So this is not the ideal laser to compare versus half-dose PDT. But Korea study was done in South America, and that used half dose PTT versus subthreshold 577 nanometer laser, and this showed that the subthreshold laser group had better improvement in vision compared to PDT, but this was a retrospective study rather than a randomized controlled trial. And here, this study was run by Dr. Lee Tae-woo in Costa Rica, and you can see in the first line there that patients that had subthreshold 577 nanometer laser had 47% had more than 3 letters gain from baseline compared to 19% in the PDT group. So here's a case where we had a patient with acute CSR of 1 month. A fluorescein angiogram showed a very focal leak just superior to fovea, and this was treated with subthreshold laser using the same treatment parameters as DME, and within 1 month there was resolution of the fluid and improvement in vision. This is the more common case that we see. This one case from Dr. Victor Chong in the UK with chronic CSCR. We can see a lot of changes within the inner retina and RPE layers. Autofluorescence shows hypoautofluorescence. And FFA shows diffuse leakage over the macula. So how do you treat this patient with subthreshold laser? Very simple. You just go the same protocol as you do for DME. And I used Dr. Victor Chong used about 100 spots using the DME protocol, and then at 6 weeks after laser, there was improvement of the fluid, but the patient's vision remained about the same because this CSCR had been there for almost 2 years. So this should have been treated a lot earlier, I think. So in summary, I like to say that the subthreshold Easyret laser for DME and CSCR works very well, and it's something I use all the time. Most important is that you have to treat the whole area of macular edema using a very dense treatment. Follow the protocol that I showed earlier, and the Gauss reps will be able to share with you the protocols that I've explained. Do not go above 10% duty cycle because you may cause scarring. 5% duty cycle is the ideal setting. Most important is to titrate the laser power before you treat over the thickened areas. So to repeat, you go outside the macula, you use 5% duty cycle, you increase the power until you see a laser scar outside the macula, then you go to half of that power, and then go to the thickened areas of the macula and then treat at 5% duty cycle. You will not see any scarring, but rest assured that there is a treatment effect. You have to wait 6 weeks to 12 weeks for the laser to show its effect. So you must be patient. Do not be tempted to give an injection. And a yellow 577 nanometer subthreshold laser is definitely better in improving visual acuity than half dose PDT for patients with CSCR. It's also cheaper and more convenient for the patients because to do PDT, you need to set up intravenous line and infuse vertiporphin, and also you need to monitor the patients after the treatment. So subliminal laser is a cost-effective option and should not be considered only for late situations. When you have a suitable patient, you should consider using this treatment option early, which will allow the effect to be better, and you may also need less anti-VEGF injections, especially for patients with DME. So thank you very much, and I wish you all a very good meeting for the Retina China 2021.